Hello and welcome patients and avid listeners. My passion for comprehensive and complementary healthcare drives me to investigate new and innovative approaches to mental health. Today we'll be plunging into the depths of telemedicine, artificial intelligence, quantum biology, and beyond. This is Dr. Desiderio Pina, the Mind and Body Doc, bringing you a deep discussion on what the future of neuropsychiatry might look like. I'll once again be your guide, navigating the uncharted waters where mind, body, and technology converge. I've dedicated my career to exploring the mysteries of the human brain, as both a clinical neuroscientist and a board-certified physician specialist. We'll explore how these revolutionary fields are reshaping our understanding and treatment of mental health disorders. From the digital frontier of telemedicine and AI, to the quantum mechanics of our very cells, the future of neuropsychiatry is as fascinating as it is complex. So buckle up and prepare to embark on an enlightening journey into the future of mental health. Buckle up, it's going to be an enlightening ride. Telemedicine has been a game changer, especially post-COVID-19, bridging the gap between healthcare providers and patients in remote areas. This digital revolution has been indispensable in connecting us with those who might have otherwise been unreachable. It's a brave new world where healthcare transcends physical boundaries and reaches you right where you are. But what if we could take it a step further? What if our computers, smartphones, and tablets could do more than just facilitate a conversation? Here's where artificial intelligence, or AI, enters the picture. Imagine a world where your device not only connects you to a healthcare provider, but also aids in diagnosing your condition. AI algorithms are now capable of doing just that. They can assess your mental health conditions with a remarkable degree of accuracy. Consider the impact of this digital frontier on the world of neuropsychiatry. It's a field where accurate diagnosis can often be a complex and time-consuming process. We have been gathering more data on ourselves in healthcare for a few years now with wearable devices and sleep pads, watches, and continuous glucose monitoring, among other digital devices. This has led to incredible individual insights through which we, physicians, have begun to tailor our treatments and interventions of each individual patient with much finer resolution, almost on a daily basis. But with the power of AI, we can expedite this process and reach a diagnosis much sooner and with a higher likelihood of fidelity and reliability. Even with helping clinicians document notes in real time, and relieving other administrative burdens like prior authorization forms and documentation, etc., AI tools are helping us spend more time with our patients, doing what we do best, which is have that intimate human interaction of healing. This is not just a futuristic concept, it's happening right now. AI is not just the future, it's the present, revolutionizing how we approach mental health. But as we stride forward into this brave new world, we must tread carefully. The digital frontier, while full of promise, is also fraught with challenges. Issues like data privacy and algorithmic bias are very real and need to be addressed. As we harness the power of AI to revolutionize neuropsychiatry, we must also ensure that we are doing so in a way that is ethical, fair, and protects the privacy of individuals. So let's continue to explore this digital frontier, embracing the possibilities it offers while being mindful of the challenges it presents. Let's continue to revolutionize mental health, one digital breakthrough at a time. After all, AI is not just the future, it's the present, revolutionizing the way we approach mental health. Quantum biology is no longer the stuff of science fiction, it's a burgeoning field that's giving us new insights into cellular mechanisms. The quantum world, a realm of atomic and subatomic particles, has always been considered separate from our everyday reality, but now we're beginning to see that this isn't the case. Quantum phenomena are at play in the very fabric of life itself. In the heart of every cell, quantum physics is hard at work. Photosynthesis, the process that powers life on Earth, relies on quantum coherence to operate with near-perfect efficiency. Birds use quantum entanglement, a concept so strange that even Einstein called it spooky action at a distance, to navigate during their annual migrations. Our mitochondria generate the power and energy of life by way of unlocking that energy stored in carbs, proteins, and fats. And they do that via quantum processes. Even our sense of smell, it seems, might be a quantum phenomenon. But what does this mean for our understanding of the mind and mental health? Well, it's a game changer. Quantum biology could unlock the secrets of how our brains work on a fundamental level. It could provide explanations for phenomena that classical biology struggles to account for, such as consciousness itself. The implications for neuropsychiatry are profound. Mental disorders could be viewed not just as biochemical imbalances, but as disruptions in the quantum processes that underpin our senses, thoughts, feelings, metabolism, and perceptions. This could open doors for targeted therapies that work at the quantum level, offering hope for conditions that have so far eluded effective treatment. Imagine understanding mental disorders at a molecular level, opening doors for targeted therapies. The future of neuropsychiatry may well lie in the weird and wonderful world of quantum biology. The mind, it seems, is not just a biological machine, but a quantum one. And as we continue to unlock its secrets, who knows what we might discover? Quantum biology is not just revolutionizing our understanding of life, but our understanding of what it means to be human. Our cells communicate through bioelectric signals, which are fundamental to cognition and establishing a coherent sense of self. But what exactly are these bioelectric signals? In the simplest terms, they are tiny electrical impulses that our cells use to communicate with each other. They're the language of our cells, an intricate and continuous dialogue that orchestrates everything from our heartbeats to our thoughts. Now, you might be wondering how these tiny electrical signals relate to cognition and mental health. Well, they're a crucial part of the puzzle. Within our brains, billions of neurons continuously send and receive these signals, forming complex networks that give rise to our thoughts, emotions, and memories. Disruptions in this bioelectric communication can lead to cognitive issues and a range of mental health disorders. Consider, for example, depression. Research has shown that in individuals suffering from depression, certain neural circuits, pathways of neurons communicating via bioelectric signals, may be less active. This underscores the fundamental role of these signals in maintaining our mental health. But here's the truly exciting part. By studying these bioelectric signals, we can gain new insights into mental health disorders and how to treat them. We're not just talking about identifying disruptions in the signals. We're talking about the potential to manipulate these signals, to restore the balance in our neural networks, and alleviate the symptoms of mental health disorders. Imagine the possibilities. By understanding and harnessing the language of our cells, we could develop entirely new therapeutic interventions. We could potentially revolutionize the way we approach mental health. But don't mistake this for a simple solution. The language of cells is complex, and there's still much we don't understand. But combining the power of metabolic manipulation of energy management by way of changing your diet, which changes what major macronutrients are provided to your mitochondria to burn, then you supplement your diet with vitamins and other substances known to increase the number and efficiency of your mitochondria and their electrical and power networks. You take in red light and near-infrared light by way of red light therapy. You also use a combination of proven psychotherapy and psychotherapeutic techniques like cognitive behavioral therapy, a low dose of an SSRI, together with high-intensity interval training exercise and mindfulness meditation, all while using an array of devices, rings, watches, breath testing, and blood testing kits, to measure your ketone production, your metabolism and blood sugar, your sleep. Add to the daily or every other day sessions of direct current therapy devices, like a TENS unit but for your brain, FDA approved for use in anxiety and depression. Complicated? Sure. But the problem is complicated, so it would follow that it isn't as simple as here, take this pill or eat this food. The road ahead is long and filled with challenges, yet it's a road worth traveling, for the potential rewards are immense. This bioelectric landscape could serve as a computational boundary of the self, offering new perspectives on mental health disorders. Psychedelics like psilocybin are showing promise in treating conditions like depression and PTSD. This might sound radical, but let's take a moment to explore the science behind this statement. In the realm of neuropsychiatry, we're constantly seeking innovative ways to understand and treat mental health disorders. Recently, psychedelics have emerged as a potential game changer. Research has shown that substances like psilocybin, found in magic mushrooms, can significantly improve symptoms of depression and anxiety. When used in a controlled therapeutic setting, these substances can trigger profound changes in consciousness, leading to long-lasting improvements in mental health. But it's not as simple as it sounds. The effects of psychedelics are heavily influenced by two factors: the set and the setting. The set refers to the individual's mindset, including their expectations, mood, and personal history. The setting, on the other hand, is the physical and social environment in which the substance is taken. Both these factors can significantly influence the individual's experience and the therapeutic outcomes. So it's not just about the substance itself, but how it's used. Psychedelic therapy isn't about handing out magic mushrooms like candy. It's about carefully guided experiences facilitated by trained professionals in a safe, supportive environment. And then there are the ethical considerations. As with any groundbreaking approach, we must tread carefully. We need to ensure that the use of psychedelics in therapy is safe, equitable, and respectful of individual autonomy. We need rigorous research and robust guidelines to navigate this new frontier responsibly. So, yes, psychedelics are showing promise, but it's not just about the substance, it's about the set and setting, as well as the ethical considerations. As we explore this exciting new avenue in neuropsychiatry, let's remember to proceed with caution, curiosity, and above all, an unwavering commitment to the well-being of our patients. As we venture into this multidisciplinary approach, ethical considerations take center stage. The rapid advancement of technologies in neuropsychiatry, while exciting, also raises crucial questions of ethics and responsible practice. Let's start with data privacy. As we increasingly rely on digital tools and AI for diagnosis and treatment, we must ensure that patient data remains secure and confidential. The challenge lies in creating robust systems that protect this sensitive information while still allowing for the necessary flow of data for medical purposes. Next, we face the issue of algorithmic bias. Machine learning models are only as good as the data they're trained on. If the data reflects societal biases, the AI could inadvertently perpetuate these prejudices, leading to unequal treatment or misdiagnosis. It's essential that we actively work towards eliminating bias in our AI models to ensure fair and accurate treatment for all. Beyond technology, innovations in quantum biology and the use of psychedelics in therapy also pose ethical dilemmas. The world of quantum biology is still largely uncharted territory. As we delve deeper, we must be cautious about the potential for misuse or unintended consequences. Similarly, while psychedelics show promise in treating mental health conditions, they're not without risks. We must ensure that their use is supervised by trained professionals, and their benefits and risks are clearly communicated to patients. In all these areas, the key is to strike a balance between innovation and ethics. We must foster a culture of responsibility, transparency, and respect for patient autonomy. As we push the boundaries of what's possible in neuropsychiatry, we must never lose sight of the fundamental principle of do no harm. In conclusion, the ethical landscape of neuropsychiatry is complex and ever-evolving. As we explore new frontiers, we must not only ask what we can do, but also what we should do. We must rigorously examine issues of data privacy, algorithmic bias, and the ethical implications of psychedelic and quantum biology research. Only then can we truly revolutionize neuropsychiatry while preserving the integrity of our profession and the trust of our patients. The future of neuropsychiatry is a tapestry woven from multiple disciplines. Just as the myriad threads of a tapestry combine to create a cohesive image, so too will the various facets of neuropsychiatry converge to revolutionize our understanding and treatment of mental health disorders. We've journeyed through the digital frontier, where telemedicine and artificial intelligence offer new avenues for reaching patients and diagnosing mental health conditions. We discussed the great potential offered by wearables and quantifying individual health, metabolism, and sleep data for a more precise diagnostic and therapeutic position to better face our health battles. These tools are not just the future, they are the present, and they hold the potential to transform not just our general health and longevity, but also our approach to mental health and quality of life. We've delved into the mysterious world of quantum biology, a field that takes us beyond the realm of classical science and into the mind's deepest recesses. By understanding mental disorders at the molecular level, we unlock doors to targeted therapies and a more profound comprehension of the self. We've explored the language of cells, the bioelectric signals that form the basis of cognition, and establish our coherent sense of self. This bioelectric landscape might serve as a computational boundary of the self, offering fresh perspectives on mental health disorders. We've embarked on a journey into the new frontier of psychedelics. Substances like psilocybin are revealing promise in treating conditions such as depression and PTSD. However, it's not just about the substance. The set and setting, along with ethical considerations, are equally crucial. And finally, we've confronted the ethical implications that come with this multidisciplinary approach. As we venture further into these new frontiers, we must rigorously examine issues of data privacy, algorithmic bias, and the ethical implications of psychedelic and quantum biology research. As we journey forward, let's remember that the future of neuropsychiatry is not confined to one discipline or approach. It's a tapestry, a beautiful, intricate, and interconnected web of knowledge and progress. By embracing telemedicine, AI, quantum biology, metabolism science, nutrition, the study of the human microbiome, sleep science, bioelectricity, and psychedelics, we can revolutionize therapeutic interventions in mental health. This is Dr. Desiderio Pina, Desi the Mind and Body Doc, asking that you stay curious and active, eat and sleep well, and most of all, be happy. Remember to check out my other videos, like and subscribe, and check out my website for more resources at themindandbodydoc.com. Be happy, my friends.